We talk about it every day, the need to provide high-quality care as cost-effectively as possible. Even so, many organizations overlook a function that has true potential to simultaneously reduce costs, enhance care quality, and improve the overall patient experience: healthcare transportation. Getting the right materials, whether they are patient-critical, such as specimens or pharmaceuticals, or business-critical, such as mail or print supplies, to the right place at the right time, has a direct impact on the ability of healthcare organizations to orchestrate optimal care delivery. The Journal of Healthcare Contracting recently published an excellent article on this topic authored by Dr. Robert Handfield. Dr. Handfield is the Bank of America University Distinguished Professor of Supply Chain Management and the Director of the Supply Chain Resource Cooperative at North Carolina State University. I am very pleased to have Dr. Handfield with me today to discuss why he thinks this is an important topic for healthcare executives to consider and those best practices that they can follow to derive the maximum value from this function. You can download this entire article from www.medspeed.com. Dr. Handfield, it's all yours.
Thank you, Jake. I'm happy to be here today to share my perspective on this really important topic. About a year ago, I started thinking about healthcare transportation. In the press, you hear about healthcare providers who are operating in an environment of lower margins, increased risks, and then there's the ongoing political debate about healthcare reform. Against this backdrop, we see people that are focusing increasingly on getting the highest value out of every health system initiative, program, or function. Managers who are trying to drive savings without sacrificing service, quality, or safety. Historically, IDN system executives have focused their attention on finding value solely within the clinical spending categories. Well, this is certainly important, but in the process of doing so, other spending areas are often overlooked, and these are areas that can constitute a significant percentage of total system spend. One of these areas, healthcare transportation, was an area I decided to take a closer look at. And what I found is that it does indeed appear to have extraordinary opportunity to add value and reduce cost, increase quality, and improve the patient experience. This is what I wrote about in my article and what I'd like to take a few minutes to discuss with you today. For this article, I conducted research with a team of students at the Supply Chain Resource Cooperative at North Carolina State University. Along with that, we spoke with healthcare and supply chain executives, as well as other industry experts across the country, seeking to accomplish two things. First of all, we wanted to uncover the prevailing attitudes within healthcare about transportation. And second, we wanted to develop best practices that can be applied toward the selection of a transportation solution provider. So a good place to start might be a definition. What is healthcare transportation? Healthcare transportation is the systematic process by which patient and business critical materials, including laboratory specimens, pharmaceuticals, supplies, and patient records, are transported to and from multiple locations within healthcare organizations. This directly impacts an organization's ability to deliver optimal care. Sometimes this movement is executed by a single entity, but more often than not, there are multiple handoffs, and it's handled by several, often misaligned vendors. After speaking with executives at large healthcare systems across the country around the topic of healthcare transportation, several conclusions presented themselves. One of the most perplexing, yet not entirely surprising findings of our research was that healthcare transportation is perceived as being important, and then it's subsequently ignored. 83% of the executives with whom we spoke identified their healthcare transportation activities as a critical component of their overall operations. Transportation touches an average of 10 different stakeholder groups across the entity, including clinicians, laboratory, pharmacy, and others. Each of these entities depends on the transportation of patient and business critical items to do their job and to support their organization's business objectives and mission. And yet, 85% of the executives we surveyed reported a fragmented approach to transportation. Decisions are often made at the department level and are not coordinated. At these healthcare organizations, transportation duties are mostly being carried out through an uncoordinated combination of internal and multiple third-party courier services with very little oversight or control. Even more significantly, 87% of those surveyed have never performed a comprehensive analysis or diagnostic looking at the total cost and performance of their overall IDN transportation activities. What's more, it seems that a lot of the assumptions being made by these healthcare leaders are inaccurate. For example, many healthcare executives view transportation as low value. However, studies have shown that internal transportation, courier services, and freight can constitute as much as 10% of the overall purchase services budget, or 3% of overall hospital expenses. That's a good chunk of change. Many miss these costs because in a fragmented network, spend analytics are often non-existent, and expenditures are often buried in many different departments and many different budget lines. The findings from my report also suggest that healthcare executives think transportation is low impact. Unfortunately, this is often a great disservice to the system and can often negatively impact the overall patient experience. The potential consequences associated with the loss of a specimen or the confusion from a misplaced delivery can result in having to redraw the specimen, spending valuable management time to recover the lost delivery, as well as, not to mention, the potential liability issues resulting from a misdiagnosis. All of a sudden, transportation is a very important link in both the care, coordination, and quality. Regrettably, none of the organizations we surveyed had a system in place to measure the implications of errors from their current transportation activities. Finally, the executives with whom we spoke believe that transportation spend is static and only increases and decreases with organization size. This is also untrue. There are many opportunities for consolidation that can be captured through scale or solution design. For example, route optimization and network redesign, changes in clinical requirements, and the addition or subtraction of facilities and service offerings can all change the needs of a transportation system. Designing a network to meet the needs of its stakeholders and creating contracts that offers formulas or algorithms for scalability can alleviate these costs. Unfortunately, once again, none of the executives surveyed had contracts in place to account for this kind of variability. As you can see by now, the perception and reality of the weight of transportation, as well as its impact and static nature, is all different. In fact, most of the executives with whom we spoke would place transportation in a low complexity, low impact commodity category, as shown in the lower left-hand quadrant of this matrix. However, the impact of transportation on the system and the opportunities for value most certainly qualify it for the high complexity, high benefit category associated with strategic services, well up in the right-hand quadrant of the matrix. Since we've established that transportation is a critical foundation for a healthcare system, the best way to create a strategic transportation asset that improves efficiencies, increases value, and fosters an ideal patient experience is to begin with a process such as the one I've outlined here. This process is very similar to what might be used in any kind of a strategic purchase situation. First, we need to establish stakeholder requirements and develop a scorecard. This involves giving each requirement a weight based on its importance to the stakeholder group, as well as scoring the current performance of the transportation network within your organization. Our research here indicates that there are three categories of stakeholder requirements in this category, which, when given relatively equal weighting, produce the optimal outcome: economic value, operational effectiveness, and strategic impact. Second, evaluate your options. There are often several options to consider, so it's important to pay close attention to the benefits as well as the disadvantages of each one. In most cases, the three available options include a general third-party carrier, an internal IDN department or function, and the one most likely to produce the greatest overall value, a healthcare transportation specialist. The third part involves creating a contract and relationship model that measures those items you added to your scorecard and holds the partner to a set of pre-established metrics for success. Once set in place, it's also important to continue to improve and enhance that service over time. As you can tell by now, this is something that I strongly believe organizations in the healthcare industry need to change. We need to change the conversation about accountability, healthcare reform, and healthcare delivery, and start including the importance of healthcare transportation in that discussion as well. It's an important but oftentimes overlooked link in the supply chain. I'm happy to have been able to share my perspective with you today. I suggest that anyone who's looking to find added value within your organization, reduce costs, and streamline operations, think about the role that your healthcare transportation can play and to start the diagnostic process today.